All right, Misty, we have a quorum for Albemarle. I mean, no, we have a quorum for the Charlottesville, not for Albemarle yet.
Hi, everybody.
Hi.
Hey there. Do we need just one more for the county?
We need two. So we need like Martha, we need Aaron, or Kevin. We need two of them.
Or Ryan?
Ryan's not going to be here, so it will not be him.
Okay.
Now we'll
Aaron's
step
coming,
away
that's
for a
good.
few minutes, about 4. So if I disappear, I'll be back.
So we just need one more.
I feel like there should be a drum roll or some sort of something. Well, how about
Oh, there's an attendee. Maybe that's Taylor.
I want to be where Andre's screen is behind him.
how about we go ahead and get started, and we'll see if we need to switch the order of the agenda to save the action items. Is that okay? Anybody opposed? We're going to jump right in. I'm going to read us into this, what may be our last electronic meeting for CPMT. So here we go. This meeting is being held pursuant and in compliance with ordinance number 20-A16, an ordinance to ensure the continuity of government during the COVID-19 disaster. Opportunities for the public to access and participate in the electronic meeting are posted on the Albemarle County website at www.albemarle.org/community/county-calendar. And we will go ahead and state our name and do a little roll call. Start with Katie.
Katie Ralston, CSA Coordinator for the City of Charlottesville.
Ellen.
Hi, Ellen Craig with Region 10, sitting in for Nita Davis.
Fantastic. Mary.
Mary Stebbins, Deputy Director, Albemarle Social Services.
Thank you. Tammy.
Hi, Tammy Johnston, Clinical Coordinator at Elk Hill Private Provider.
Thank you. Beth Baptist.
Beth Baptist, Interim Supervisor of SPED, Charlottesville City Schools.
And Andre Key.
Andre Key with Andre Key's Mentoring Service Private Provider.
Sue.
Hi, I'm Sue Moffitt. I'm the Director at Charlottesville Social Services.
And Jennifer Wells.
CSA Coordinator for Albemarle County.
Aaron Callis.
Good afternoon, everybody. I'm the representative from the Charlottesville Albemarle Health Department.
We could, well, at least I could barely hear you. I mean, I heard you, but that's also maybe because I knew what you were going to say. So it was real soft.
Let me try. Is that?
Did you talk to me?
Can you hear me better or no?
It's the same.
I'll see what I can do to fix it.
Okay, Martha's here. We got a quorum.
Yahoo! All right, we'll continue with Taylor Ellis.
Hi, Taylor Ellis, DSS Specialist with the CSA for Albemarle County.
Thank you. Martha Carroll.
Carroll, Court Service Unit Director for the 16th District.
There's a similar situation with your sound as well, Martha, but I may be alone. Is anybody else having a hard time hearing Martha? Okay, I see lots of heads nodding.
Is this any better?
A little bit.
Okay, Martha Carroll, Court Service Unit Director.
Thank you. And Ashley Marshall.
Ashley Marshall, Deputy City Manager for the City of Charlottesville, and I apologize, I'm having camera issues. I'm going to try to work on it when I'm present, but I promise I'm really here.
Thank you. I'm going to take a moment to specifically welcome 2 new members to CPMT. So we were able to approve and have some new provider reps join us for CPMT. Welcome. And I'm hoping that maybe you all can take a minute just to say what organization and provider you are representing, but if you want to just introduce yourself and if you've had any sort of connection to CPMT, anything else you want to share with the group.
I guess I'll go first. I'm Andre Key. I'm with Andre Key's mentoring service, just providing mentoring, supervisor visitation, parenting coaches. I guess I'm just new to CPMT.
Fantastic.
Hi, I'm Tammy Johnston. I'm the clinical coordinator at Elk Hill, and Elk Hill supplies residential community services and private day schools services. I've been with them for about 13 years, and I used to sit on FAPT years ago for Albemarle County, where it's shaking her head. So I miss you guys, and I'm glad I was able to come back.
You're welcome. Appreciate you all filling out our CPMT so we have more diverse perspective and some provider voice at the table. So I appreciate you all for being here. And we will jump in since we do have quorum. We need to approve the July 2022 minutes and the financial reports. Can I get a motion to approve the agenda and the financial reports from the county, please?
So moved.
Is there a second?
Can you hear me better? I second it.
I'm working with you, Aaron. I got you. Aaron Callis, second, did that. All right, all in favor for the county? Any opposed or any other discussion? I guess I should ask that first. Tammy and Andre, you'll understand I'm sharing this, but I've been doing it for a year and still can't get it right. So appreciate in advance your understanding.
You're doing a great job.
Thank you. Appreciate it. Was there anyone opposed? All right, let's move on to the city. Who's going to make a motion?
I move that the agenda and financial reports for the city for the month of July be approved.
I second it.
Who seconded?
Beth.
Baptist. All in favor?
Aye.
Any discussion? Any opposed? All right, those motions pass. You all are following along on your agenda. We will move to some action items. So I believe this is going to be handed over to Katie and Jennifer to talk about the approval of the private provider reps for FAPT.
Yeah, so we meant for this to come last month and get approved. So we advertised for the FAPT private provider reps starting back in the spring. I needed to keep it open a little bit longer to get a couple more applications. And so for the city, we had one candidate really after talking with Andre and him saying he really wanted to, he was more interested in CPMT. We had one candidate left that the FAPT chair and I interviewed and then vetted through FAPT, and that is Cassandra Winfrey. And she is with Health Connect America and really eager to get started and involved with Charlottesville FAPT. So we would like to put her forward for approval as the FAPT private provider representative so she can get started.
Is there a motion from the city?
So move.
I can't see y'all because my document blocks you, so I don't know if I don't recognize the voice. I don't know who made the motion.
Beth Baptist made the motion.
And Sue Moffett second.
Okay, thank you.
Is there any other? All right, Jennifer, do we do discussion? Ayes, nays, discussion first? Of course, that makes so much sense. Let's do some discussion at this point. Any discussion about the new provider rep for City Fact? Okay, all in favor?
Aye.
Any opposed? Okay.
All right, so for the county, the person we're putting forward is Dana Scott. She's with National Counseling Group. And yeah, I don't know if folks have any questions. Katie and I went through a similar process of folks submitted applications, we did interviews. So Ellen Craig was actually our FAP chair, so she sat in on the interviews with me, and that was the candidate that we wanted to put forward. So if folks have any questions about that, I'm happy to answer.
All right. Would anybody like to make a motion at this point? Motion would be to approve the private provider rep Dana Scott for County Fact.
I move that we approve Dana Scott for representation on that.
Thank you, Martha.
Mary
Who-
Stebbins seconds.
Thanks, Mary. Any other discussion? All in favor? Any opposed? Okay. Appreciate that FAPT also has gained some private provider representation. That's excellent. Thank you all for bringing that to CPMT. We are on to nomination of CPMT chairs. Who would like, does anybody have any interest? We visited this topic last month. Does anybody have any interest or willingness to serve as the county CPMT chair?
I can do it. That was Mary. I can do it.
Great.
Yes, Mary. Yes. I can't wait to share this chair seat with you.
All right.
I think we voted last time on the city chair, correct? We took care of that last time? Okay, well, that's presumptuous of me.
I actually was remembering that maybe you weren't there, because you and I talked about whether or not you wanted to do it
Oh,
again.
that's right, Lindsay took my space. Okay, I would also be willing to serve as chair for the city CPMT.
So moved.
And
We're doing
Beth
the city
Baptist
vote.
seconded it.
Quick.
Do you facilitate a vote if you're the one nominated? Okay, any discussion about whether or not should be the chair for the city? Okay, all in favor? Yes, I vote for that. Any opposed? Okay.
Thank you,
you all.
Missy.
You're very welcome.
You've been
I'm
doing a
honored.
great job.
I'm honored. I'm honored. All right, Mary's turn, unless there were other folks that were going to express willingness and desire to be the county co-chair. Well, then, does someone want to make a motion for Mary?
Move that we approve Mary for chair from the county.
Thank you, Martha.
Second.
And Aaron's waving and saying second. I hear you a little bit better, I think. Any other discussion? All in favor? Let's see hands. Any opposed? There are none. That passes. Mary, how exciting. Welcome. Congratulations.
I thank you.
All right. We also wanted to have a little follow-up conversation because this sort of similar situation happened last year, where we weren't quite sure who was willing to, the sort of fiscal year sort of snuck up on us, and we were at July and had to make a vote, and nothing happened. Nothing happened. And so we didn't have like chairs for a hot minute. And so now, after having sort of a similar thing, we talked in our agenda planning meeting about how we might encourage folks to consider being sort of next in line. It doesn't necessarily mean, so whoever's chair can be chair, you know, for however long they're willing to be, or they don't have to, you know, they can express their willingness. But it would be nice to know if there was somebody that would be interested in taking the chair seat next time. Just at least to have an expressed interest. Katie, were you going to say something in addition to that? I couldn't tell.
I was just curious. I'm sure there's a lot of you that sit on a lot of groups, and are there ways that this is handled on other groups that you might sit on that work? Like, is there a rotation of some kind or a process that makes it less like you're, you know, having to have this conversation in a kind of contentious way every year?
So Katie, I would say that Madison has a rotation. That's the only one of my jurisdictions that I think really sort of has a process for. But it seems like they've done the rotation for a long time, and it's worked fine.
Was it annual or every 2 years, and does it rotate based on seat?
I think it's annual, and I'm sorry, I didn't understand your other question, Missy.
Just like what, so is it based on individuals getting into a rotation or the organizations that they are representing?
The organization is my perception of it anyway.
Any thoughts on that approach that Martha shared? Pros, cons?
I mean, I like the idea that there be a process so that it's not a painful discussion every year and no one feels obligated. I think organization is a great idea, organization rotation. I think there might be some benefit to not having, you know, it'd be 2 social service people, 2 school people, 2 private people, that we have opposites somehow.
I was just going to add too, we likely wouldn't add the parent rep in the rotation. And then there's sort of a question about whether you would add the private provider rep, because we're going to renew those folks every 2 to 3 years. And so it might not be realistic to, depending on how, you know, how long they've been in the term, whether that would be reasonable or not.
I also think that we might want to put a placeholder in like an earlier agenda setting meeting as we're getting closer to the fiscal year, so that we're talking about this in, say, April or May, so that folks can start to be thinking about it. I thought, you know, the job description was a helpful resource that was shared, so folks kind of know what's expected. I can share from my personal experience. You know, it's you know, it has been pretty straightforward. This group is pretty supportive and, and understanding. Yeah, and it's an additional planning meeting the week before the chair, or before the monthly meeting with Katie and Jennifer and Lisa. And last time we were joined by Taylor. So it's a great group just to kind of be thinking ahead about what might need to be on the agenda. And it's a really supportive group. So I don't know if we'll remember to put it on our April or May meeting. Maybe I'll go ahead and enter in a reminder on our personal Outlook calendars to do that. Is anybody opposed to like an organizational way to do this?
No, I think it's a good idea. For all the reasons that have already been mentioned.
All right. Well, maybe at our next planning meeting, we can craft what a rotation might look like to sort of make sure that the rotations on county, like what Sue was saying, is from different organizations taking a turn at that. And then can kind of bring that back up to the group. All right. Thanks, everybody. Now we've got that figured out. We're on to review of system functioning and activities, starting with a FAPT update.
Oh, go ahead. Do you want to go?
Sure, it doesn't matter. I think in the city, I think the summer's kind of thrown us off a little bit. I don't feel like we've really been meeting regularly, and we continue to not have to meet regularly because case numbers just continue to be down. So, you know, we're still missing at least 1 week a month where we don't need to meet because there aren't cases to staff. And I think the other thing that we're going to start talking about is how we kind of conduct business moving forward. You know, I think Jennifer and I, we're going to talk about this during the CSA coordinator update, but we can talk about it now. We sent out the FAPT virtual FAPT guidance document. And I think we are very aware of a lot of what's already in that document and how we're able to ensure that we're meeting, you know, the goals of FAPT and, you know, aware of what the barriers may be in terms of meeting virtually. I know City FAPT in the past, when we've had these conversations, is certainly interested in continuing to meet virtually. It seems that we have greater participation when we meet virtually. And it just makes sense since our meetings are so short. You know, they're 10 or 20-minute meetings. And so I think the plan would be to share that document with FAPT in preparation of having that conversation. But I know we also wanted to share that with you all to get any feedback that you all might have, as you know, FAPT is a function of the CPMT. And since CPMT is going back in person next month, and as well as program, since they're both public meetings, just wanted to see if there's any feedback from you all to take back to our FAPs and having this conversation.
Is there any data on parent participation since we've been doing it virtually?
I don't know that we've been keeping data on parent. I could certainly probably go back and do some work and figure that out maybe. I think the overall sense is that we feel like we've had more participation in the past couple of years since meeting virtually. I can imagine it's certainly easier for folks to, you know, everybody has a phone pretty much, to jump on even a phone call if you can't, you know, if you don't have Zoom or the ability to get on a virtual platform like that. Logistically, that is much easier than, you know, physically coming to a meeting. But we don't have any numbers.
It doesn't feel like there's a lot to me, but then we've been meeting so kind of irregularly that it's hard to get us. I don't feel like I have a good sense of it.
Yeah.
So I'll just say on the county side, I don't know that we've seen diminished numbers. I mean, you can see from the FAP survey results, a lot of them go out. Obviously, we don't get as many back when we mail them, but I don't think that it's been fewer folks participating. It does seem like there are parents who are able to do this, whereas I don't know that coming in person would be manageable for them.
And I think just the nature of how our system is set up, you know, a lot of the parent participation happens before the case comes to fact. So, you know, that document that was sent out, it was sent out to all the localities in the state. And, you know, we're very unique. I think there's maybe one other locality that where FAPT really serves as like the funding authorization, not the service plan development body. So just keeping that in mind too, a lot of that parent participation that they mentioned in that document really happens out before the FAP process for us.
So part of what I was just going to mention is what would be helpful is for us to be able to draft some local policy revisions to really clarify that our FAPs are permitted to do this virtually, continuing to do it, because I feel like just like this meeting, we were operating under that emergency ordinance, which is going to be lifted come the middle of September. So it would be important for us to try to have some things in policy that allow us to continue to have FAPT virtually. So if folks are supportive, then that's probably something we're going to bring to the September meeting for you guys to approve. That just really kind of clearly spells out that we're allowed to do it. Right now, I feel like we have kind of enough things in place that let us get by with it, but I think it would be much better to have it very clearly drafted in our local policy.
And I think that was kind of the intent of sending that out, was kind of like a guidance document for localities to establish their own policy and guidance around meeting virtually.
I like the idea of it having language that says FAPT is permitted to. That way, if folks on FAPT feel strongly about it changing back to in-person, but at least they have permission to maintain virtual if they feel like it's working for the staff and the participants. So I'd be happy to entertain that addition to the policy. Anything else from FAPT? FAPT update time?
Yeah, I mean, the only other thing that's really come up is, and that we continue to talk about is, you know, we see a lot of families in hotels. We just last week had a family that finally got housing, and we had been paying for a hotel probably for over a year for this family. So housing continues to be a huge problem.
Yeah, I can definitely echo that in the county.
Yeah. Thanks, Katie. Jenny and I were just talking about that actually, and that family was close to 2 years, and we today have 10 families in hotels.
Wow. I didn't realize that there was such a uptake on the hotel stays for DSS, because we've also seen an uptick of emergency housing needs coming from referring partners and individuals who call the homeless information line that are medically compromised, and the shelters are full or they're not, they're on a wait list for Premier Circle. So it mirrors what we're seeing as far as an uptick as well. Any other comments? And the next agenda item is similarly related, but reviewing of the foster care expenses and the FAPT approvals. Does anybody have any comments or questions about that? Those that came through. or any other trends that we should be aware of as a group?
Well, just, I think something to be thinking about and educate ourselves on, because one of the things we wanted to do was do a better job of legislative advocacy, is Matthew Murphy gave me a tutorial on voucher use and fair market rent. And both localities their fair market rent is above what there's no way people can use their vouchers in apartments in city or in the county because of the fair market rents. And that seems like something that we need to change. I know we've got at least one person I'm aware of who's about to lose their voucher because they haven't been able to find a place anywhere. So I know I personally need to learn more about that, but I think we as a group can put some data together and make sure that the legislators know about that.
Is it helpful to have somebody like that come and speak to FAPT or CPMT to increase awareness of the issue?
I think that would be a great idea.
I think so too.
Is there a way that we can get some data for how much money we've had to contribute to pay for housing related costs as part of the advocacy efforts? Or how many families have been impacted by the fair market rent constraints?
I can check with Kevin about that as far as CSA dollars goes.
I don't,
Matthew said he would send me some stuff in writing, so I'll see if that includes that. And if it doesn't, I'll ask him for it.
Yeah, for CSA, it's all kind of housing all goes under material supports. And so that's a pretty broad category of costs that get reported. And so we'd probably I'm not sure if we're able to break that down specifically or not, but I could ask.
And I can put it on my radar or ask Sue to see if he's available for next CPMT meeting once we pick the next date and time.
Sure. I'll do it, Misty. I'll follow up with him.
Thank you. All right. So we're looking at the next item is the CSA Coordinator update.
All right. So what do I have? I've got the FAP survey results that I sent out this morning for folks. Sorry, I should have brought that up during the FAP update. As you can see, continued positive remarks, but obviously a really low response rate from folks. So, you know, that particular survey gets mailed out. We'll be talking about the provider satisfaction survey under the program update. So I'll wait for that. The other thing that I had, as you guys might remember last year, the Board of Supervisors has this form that we have to complete annually. And so it's due now. So I'm going to be working on that with Lisa's help. She's been super helpful. And so basically they track all the meetings that happen. What's the purpose of this group? Who attended? When were they present? When were they absent? A lot of that stuff. So Lisa's been able to help me with that, which has been a huge help. And then the other piece of it is just a summary of milestones, accomplishments, and challenges. And so again, Lisa kind of pulled some things that she knows that CPMT's worked on. So I was just going to list those out and then see if you guys have anything that you would want to add to this list before it gets submitted. I believe it's due in like September 1st or at some point in September is when it's due. So what she has on here is the annual work plan review that was completed at the May 21 and June 22 retreats, the annual service gap survey that was reviewed and approved, the annual CQI tool, the participation and debrief for the groundwater training, the roundtable discussion of the DEI, looking at our goals and the work being done at each agency. We had the draft of the equity statement that's going to be used in CPMT work, and then the parental placement case discussion pertaining to Dcsc policy. So those were some of the highlights that she had. And I didn't know if folks had anything else that kind of comes to mind that you think would be worth adding to the list before it gets submitted. And it may be worth mentioning these housing challenges that we're seeing if you all feel like there's value added and bringing attention to that to the Board of Supervisors through this report. We could certainly add that.
And you said that the conversation about sort of the therapeutic crisis needs of kids and placements was something that we talked quite a bit about, and the challenges there. I would imagine they may be already aware, but just the lack of space and the critical needs of the youth right now. Thanks, Lisa, for helping to compile our highlights. That's awesome.
Misty, are you talking about the level of acuity that is seen when being assessed for hospitalizations and the availability of those hospitals? Because that's a big issue right now as well.
We were specifically talking about therapeutic treatment centers, correct? Mary and Sue can talk more, and Jennifer and Katie, but not having.
Yeah, there's also been a need as far as hospital placements for, you know, assessed kids that need that level of care for that period of time. There's been a long bed wait, so, and/or they're just there for weeks on end, and then they're just released because they've been there for so long in the hospital, waiting for a bed.
Yeah, I know Nate has brought that up before in the past, that Region 10 definitely continues to contend with that for both adults and children. And so that also brought up the whole report that CPMT is supposed to be filing when we can't find acute beds. That's supposed to be reported. So hopefully that's something that's getting done. There's one for acute beds and there's another one for residential facilities if you can't locate a placement for kids. That's supposed to be reported to DBHDS. So just a reminder to folks that that's something we're supposed to be doing. And we left it with Region 10 was going to do it for the acute beds, and then the DSSs become responsible for those kids that need residential that they can't find placements for. But ultimately, CPMT, the responsibility for it by code lies with you all. So we're relying on our partners to make sure it gets done, but ultimately the responsibility falls on you guys. So I just wanted to clarify that. So if there's nothing else, I'm going to add that, and then I will get this sent on. And then the only other thing that I was just going to mention to CPMT is the whole conversation about the Dcsc referrals that we were finally able to kind of get together with the two DSSs in Region 10. And what we're going to propose is, so we have like the 4 categories where we list out the Dcsc referrals. So as it pertains to DSS, that's DSS code that makes that happen. And so DSS has a process for claiming good cause and that sort of thing, but that whether they do that or not lies with the DSS. As it pertains to community-based, we've never pursued support on those cases. We obviously can't pursue on IEP placement, so we don't. And then that last category that got left was the parental placements. And that's where the parents maintain custody, but Region 10 typically case manages those, sometimes the CSU. And that's where parents maintain custody, but CSA is used to pay for the placement costs. And that's the category where we did refer, when kids go into residential, we did refer those parents to DCSC. But after a lot of issues with the changes that DCSC has made, it's not administratively feasible for us to try to do something in-house. So what the group came up with was just to make that another exempt category where we're not going to pursue parents who have their children in parental placements. So to keep it short and sweet, we're just going to add it as an exemption with a little blurb at the beginning saying, just about undue stress and just going through that process, and that we shouldn't, we wouldn't want parents to not place their children who need placement because of fear of like that whole process. So Katie and I are going to draft some language to bring to you guys probably next month to make that change to local policy. I am going to send it through the county attorney because it does bump up against code, just to make sure that they're supportive of us moving in that direction. So as long as that all works, then we're going to make that change, and then we'll know if it's, feasible when we get audited and whether OCS goes along with what we decide to do. So, yeah, so I think that's the only updates I have. Katie, I don't know if you have anything else.
I think that was it. We already talked about FAPT, and we're going to talk about the other stuff later. So
I appreciate you guys getting together separately to hammer out the details on that. Appreciate it very much. Thanks. And so are we doing OCS next, or did we not have any OCS?
Yeah, there
No,
was
we
just
did.
one. There was the 2210, and that was just the compilation of the service gap survey for all the localities across the state. And just kind of quickly glancing at it, I will say the issues that we are seeing in our localities, I think, are statewide. So there's really not something new or different from that report.
We are on program. Are you all reporting on program as well? All right.
So a couple of two updates really on two things that program's been working on. One is the UR for mentoring cases. That's kind of been put on hold until Region 10 hires some more staff and has the capacity to really work on that. So just wanted to let you all know we haven't forgotten about it. It's just kind of been put on hold for the time being. The other thing that program's been working on is the satisfaction survey. And we've been looking at those results quarterly. And the most recent results, we're finding that our response rate is very low. And so program, had a conversation about what's going on, what, if anything, we might be able to do differently. I think it's one of those things where, with surveys, it's just hard to get people to complete them unless there's some sort of motivation to do so. And, given all the things that are going on in people's lives, it's probably not a priority for, most folks. So we're going to continue having conversations about that. We do have something in place. We're just not getting a lot of feedback or a lot of surveys completed right now. And Jennifer, I don't know if you have anything else to say about that. Those were the two updates from program.
And just to recap for Tammy and Andre, the spirit of the provider feedback survey was so that families could provide feedback on sort of their satisfaction with their providers. Do they feel respected? Do they feel like their voice was incorporated in service plans? Do they feel like their provider was timely? Do they feel like their cultural identities were honored in the service delivery? So there was, we worked on the format of the questions, what we wanted to know from families. And so here we are, we've been piloting it for a little bit. What we're learning now is that the response rate for that hasn't really given much meaningful results. And other than having caseworkers be more cognizant of who they were, contracting with as providers, I'm not sure that there was a clear, straightforward way on how to deliver that feedback if corrective action needed to take place. But we wanted to, that was the intent, or the intent of creating a survey for families to fill out. Any thoughts or feedback for program? Because I know that program functions best as an arm of CPMT when they're engaged in meaningful activities, and their purpose is to focus on providers and gaps in providers, and And so I don't know if Katie and Jennifer have other feedback for CPMT and how we can support programs functionality.
I always find that getting feedback or having those fill out surveys are better done in person than, via internet or what have you. I'm just wondering if there's some way that can be incorporated that when they come to FAPS, maybe they're able to fill out the survey at that point, or whoever their case manager or the private provider can get it. And then they are also supplied an envelope for them to put it in and sign across the back so that it's confidential as well.
Is there any way you can go out with the family survey, the one that they're already filling out via mail?
So the only thing with the FAP survey is that one goes out to folks who participate in the staffing. And so, that wouldn't be every case with people able to provide feedback.
Other regarding the getting feedback on the quality of services our providers are providing, with that being the intention, any other strategies or thoughts from the group about how to move that initiative forward? Do we want program to continue to work on that? Do we want them to, do they have a plan of action? Maybe you guys can share as far as how that's going for.
They haven't totally given up on it. I think it's kind of an ongoing conversation. We made revisions to the questions, so we've had kind of 2 reiterations of the survey already. I think there is this kind of recognition that, it's probably not priority for most of the folks that we work with. Most of us probably don't fill out a survey when we get a text message, unless there's some sort of motivation to do so, or it's, super important to us. So, I think that's part of the reality too. And so we're continuing to have conversations about it. Program hasn't given up on it. Just wanted to kind of update on the status. And if you guys have any great ideas, I'm sure program would love to hear them. We're going to keep doing it, but kind of where things are right now.
Yeah. All right, so we have done our review of system functioning and activities, and we're into other business, which I know that this is very important to resolve, which is why it's letter A. So we've had ongoing discussions on changing our meeting day and time so that I think one of the big conflicts was that the Board of Supervisors meeting sort of conflicts, and it really limited some ability for folks to come, or, thinking about a day and time that might work better for folks. And so Lisa sent out a poll. We also know that this next meeting will be in person. The city council will be reviewing their, going back to normal procedures at some point in September during their council meetings, but it won't likely be resolved by the time that we need to show up in person for Albemarle County. So we are asking, or I'm asking the city folks to prepare to go to that meeting in person. And we can talk about it for future reference once city council weighs in whether or not the city is required to offer a hybrid piece. But for this September meeting, so that we can meet together, I'm asking that we all go in person with the county. And then, like I said, if the city folks are allowed a hybrid option, I'll let you know once we hear from city council. So the top 3 meeting choices, The second Tuesday from 10 until 11:30 was one. I will say that myself and Ashley, who are currently, and Sue, we have a council agenda setting meeting that's 10 o'clock every second Tuesday. So that doesn't work for the city.
And I was also just going to throw out there that Nita Haiti, she emailed and said that she can't do any of the Tuesdays. So just based on the choices that were presented, that leaves this one for a Thursday. But again, the question becomes, would a Wednesday morning work? I don't know. So if
Yeah, the court service unit would have a problem with the Thursday. That second Thursday is a standing regional meeting. So we'd probably, between Krista and myself, and we'll miss a huge chunk of them.
okay.
I think, standing meetings that, you're required to attend are hard to reschedule. I don't know if folks have like other days of the week where they may have a supervision or a one-on-one scheduled in which they might be able to switch that around to be flexible, but it doesn't seem like the options that are currently on our top 3 list are real options. So let's move away from those options.
I was going to say, I don't know if this makes a difference, but like this meeting already happens on the 3rd Wednesday of the month. If we could just move it to a morning time, would that work for folks, or is that just not? I don't know, just throw that out there.
It would work for me. And if it didn't, the only other things that I have are one-on-ones that I can reschedule. So the 3rd Wednesday in the morning would work for me.
Yes, well, I could do that. I could move what's on my Wednesdays.
You
Me
got
too.
2 co-chairs.
For the 3rd Wednesday, for sure. Yeah.
Yeah.
So that's.
You hear me?
Yes, Aaron, I hear you.
Okay, I did many things, like I'm so computer savvy. I can do Wednesday, but there's a big, huge VDH meeting from 8:30 to 9:30, so I could probably do 10. But Wednesday works, but I just want to push it a little bit later.
And for me, the 3rd Wednesday has to be before 11:30.
So I'm hearing Wednesday from 10 until 11:30 so far. That's what I'm hearing.
Mm-hmm.
Do you need transition time, Andre? Do you have to be somewhere at 11:30?
Yeah, I gotta be at 11:30, so like 10 minutes or so, I guess.
This whole adjusting for transition and drive time. It's interesting, right?
Right.
So could we do, Aaron, 9:45? We do 9:45 to, what is that, 11:15? Oh my gosh.
I'll see your 9:45 and raise you. That's what it sounds like. No,
Yeah.
9:45 is good.
So I'm hearing that's okay for Andre, Sue, Mary, Aaron, Martha's nodding. Ashley? What about Beth? Beth?
It's Ashley. You don't want my answer. I just looked at every 3rd Wednesday and through December, and I would never be able to make it.
Yeah, Wednesdays are really hard for me in the mornings. I can make it work probably for one Wednesday out of the month, but Wednesdays are definitely difficult in the mornings.
We were close. I'm gonna grieve that. For a moment.
I would also say, though, for for you to grieve maybe a little less. I think the problem is for my schedule in particular, things have been set based on the fact that I had this time booked. And so like in like December 21st, there's a budget review meeting that's already been set. So just also know my schedule is nuts. I'm not helpful when it comes to scheduling.
Okay, I'm gonna say something real crazy. What if we keep Wednesdays, every third Wednesdays from 3:30 to 5? What do we think? No, still can't do, no, Martha, we can't do that? Oh, we can, okay.
Yeah.
Was the original conflict with the county government office?
Yeah.
I
Yeah.
mean,
Or
is
board
there,
meeting.
I hate to say this, but is there another person that could come, or are they all in a meeting at that time?
I think if I remember Ryan's statement correctly, because of how their council meeting goes, everybody is there to be prepared to respond to council.
Yeah.
Is there someone else from their budget office that we may want to reach out to? Does everyone from budget have to go?
I don't know the answer to that.
Yeah, I was gonna say, I don't know the answer to that, but I think the question will be, how is that requirement written? Like, if it needs to be a decision maker, even if, you know, Timmy could come, if Timmy's not a decision maker, it doesn't help you. And that, I would say, from a city perspective, is sort of the interesting conundrum, because you all require someone from the city manager's office. So I couldn't even send Chrissy Hamill, who's our budget director, in my stead if I can't go. So
I think the code says local government representative. I'll check, but I think that's all it says.
Maybe that's just historically what's been done. I feel like I know for sure community attention is named. I feel like.
I think that would be an interesting question, though, as you all look for potential flexibility in dates and times, is who by code is the person that needs to sit in the seat, because that could provide some flexibility if once a quarter Ryan could come, but you know, the second time he may need to send someone else in his stead. So I think that that may be helpful to know for certain.
It's also possible.
I'm looking right now for the exact language, so I'll be back.
Okay, thank you, Katie. We also can flip the order of our agenda unless we're required to have it in that format. But if we needed to save the voting to take place at 4, then we can do a revamp of the updates and do updates first, then votes, then other business. So it allows folks to appear for the voting pieces. Where are we intending to meet at the McIntyre county office buildings?
I think we were looking at 5th Street, but I think the reality is we're going to have to find whatever space we can find to use. I can't say for sure. That's why I needed the date and the time, because I've got to find a meeting room. So once we land on that, then I can check to see what's available. it's a little bit easier for us to do it at Fifth Street just because we might have a little more pull in getting a meeting room than we would down at McIntyre. Whereas like when it comes to the Board of Supervisors and those groups, they're obviously going to take priority in needing meeting spaces. So I can't say for sure, but it would be one or the other.
So it's really interesting. The policy says one elected official from the governing body or its designee in terms of the local government representative.
Can you run that back one more time?
One elected official from the governing body or its designee.
That explains it, because some of the rural jurisdictions have a board of supervisor representative.
Yeah, that's interesting.
You know,
So it
Fluvanna
would
and
be like a.
whatever.
it'd
So
be
it
like a
means that the Board of Supervisors has designated budget.
In some case, in one case, Madison does that, yeah. But at least three of them actually send a board of supervisor member.
Interesting.
We have a conference room that we would be welcome to use. It's not huge, but we made some changes during the pandemic. It's probably comparable in size to the room at Fifth Street that FAP used to use. I don't know if that's what the space you were thinking about, Jennifer, or not. And we have parking, so.
Who's the best person to check in with Ryan or about keeping Wednesdays, and are there other designees or the Board of Supervisors, I guess?
I can check in with him about it. So if nothing else, what we can do is just planning for September. We can just leave it the third Wednesday at our regular 3:30 to 5. I'll try to find a meeting room, and then I guess my question would be, are folks okay if it's Fifth Street or if it's McIntyre? It would be one or the other. If they're not available, then we could look at the court service units meeting space. If that works for everybody, at least for September, and then we can, visit it again if we need to, or if it seems like we're okay, we can just go with that. Does that sound all right? Okay.
I'm not sure. I'm not sure how to get around this issue of selecting another date and time. Other than potentially saying we will change the date and time in January. So folks have time to change schedules. If it sounds like Tammy says that's like giving folks notice, especially if you have clients on your list, we need to make accommodations for this. It sounds like Ashley said that if this afternoon time became available, that might be a possibility. So can we potentially work that out, Jennifer, Katie, Mary, through email so that we don't have to wait to pick our next or get that information out to folks?
Are we looking at the third Wednesday from 9:45 to 11:15? Is that that's what we're trying to plan for the future?
Yes. And maybe giving folks time to, would that help you at all, or would that even be possible? Could Wednesdays mornings look different for you, I guess, by January?
Yeah, for the third Wednesday, yeah.
Okay. Okay. All right, stay tuned on that, but we know for sure that next month's meeting will be happening in person. Stay tuned to the location.
And I think it was just Ashley as well, right? So Ashley can plan ahead too for that as well.
Ashley, you said that was maybe possible. Is that possible, you think, if we decided we had to make a change to accommodate the county? That those appointments can be switched?
I'll do my best. I think for me, Katie has brought up the question of, is it habit that it's a city manager? Or is it required? Is that who our council designated? Because if there's a day I can't go and I can volunteer someone as tribute, then that gives a lot more flexibility to your dates and times. So it's not that I would never be able to make it, but if we know that I can, that someone else can step in my stead, should there be a meeting I can't move, I think that would be that'd be very helpful for me to know.
So Ashley, is that something, who do we take that up with?
If it is that the question is, did the council designate the city manager and then the city manager designate someone? Did the council designate a deputy? I have no idea.
Yeah, I mean, it would have happened so long ago.
Yeah, no clue.
Yeah.
I know for the county, I believe the Board of Supervisors appointed Ryan, like the specific person versus the position. But it does, if I'm reading it right, it means that he could send a designee. So if that's the case, then there might be some flexibility with whoever is actually the person appointed being able to send a designee.
And Jennifer, I'm a little cautious about that, because if I heard Katie right, it is supposed to be a local government official or their designee. So if the Board of Supervisors designated Ryan, he is the person. He does not have the opportunity to then sub-designate. That is not the right word, but it's what came to my head.
I think that's right. And I don't know if they'd be able to designate two people or have multiple designees. You'd probably have to find, when that appointment was made and what it said exactly.
What's the best way to get the county to discuss their designee status?
So I can talk to Ryan about that when I ask him about the meeting time, letting him know about the meeting time.
And I also meant to say council. Ashley, what's the best?
Probably an email to Kina would be my first jump, because as I said, I have no idea how the actual designation was created. And I'm going to be honest, if it was created, or is this just historical vestige practice? Because it may not have always even been the deputy, because prior to Mike, I don't know who they were, but you maybe didn't have a deputy that had a, knowledge of child welfare or social services or human services. I know that before I came, there was a space where there wasn't a person who had that kind of background and knowledge. So you could have sent someone. That doesn't mean it would have been helpful. So I don't know how it got designated.
So is that somebody in the clerk's office, Ashley?
Kina is the clerk of council.
Yeah, I was gonna, maybe she has to find the resolution.
Yeah.
Yeah.
And I have no clue where to even start.
If it exists. Because I know, that we've had some turnover, so I'm not sure.
I will initiate an email and copy you, Katie, and Ashley to Kina to at least try to start there.
I remember hearing that there was a lot of issues with Tuesday. What was the issue with Thursday? I can't remember.
We have a regional meeting the second Thursday of every month that I don't control that schedule. What's required.
What about like the first or third Thursday?
Yeah, it's only the second Thursday.
Albemarle County can't do the, DSS can't do the third Thursday. Unless it's after 10.
What about the first Thursday?
What time?
In the morning, I think everybody's trying to strive for the morning.
I can make it work.
I can as well.
I don't want to jinx anything, but it looks like I could generally make it work.
Oh my
I know,
gosh.
I know, I
I
can
know, right?
too.
Like, I'm not going to say it too loud.
All right, let's do it this way. Thursday, 9 to 10:30. The first Thursday, 9 to 10:30. Anybody cannot do that. Speak now. Tammy Johnson, VIP of this month's CPMT meeting. Amazing. That takes 3 months to figure out. First Thursdays. That means we're going to have a quick turnaround between now and the first Thursday of September.
Which is the first.
What time did you determine that no one?
9 to 10:30.
I'm not sure if I'm still going to be doing it for Charlottesville on September 1st, but I'm not available on September 1st. It's not like every first Thursday, but that day I'm not available.
I see. Is there someone you can send in your stead?
Probably.
Okay. We are going to put down September 1st, 9 to 10:30 as our anticipated date. Thank you again, Tammy, for your magical presence and influence over the space. And Beth, hopefully you can find a designee from city schools to come represent city schools. And Jennifer, hopefully you have good luck finding that time, space. We also have access to city space too that we can offer. So we got that too.
There's potentially room at Region 10 as well for a meeting space. I don't want to overpromise. Nita would need to make that decision, but it's possible.
We got space. All right. Wow, if that isn't something else. All right. Other business we wanted to talk about is the CQI tool and looking at data by mandate type.
And Misty, I apologize. I just wanted to let you know, in case something happens for the first, I went ahead and held city space. So we don't have to use it, but I snagged it.
Great, thank you. Katie, Jennifer, which one of you are facilitating the CQI tool and the mandate type discussion?
I don't know if we really worked that out. So we talked about the CQI tool at the retreat. And so this was the kind of updated CQI tool after that discussion. It seems like it was so long ago, even though it really wasn't. I feel like there was conversation about trying to break down some of the data a little bit more by mandate type. And I'm trying to jog my memory and see exactly what we were kind of wanting.
Yeah, what I was going to say, so we sent out the CQI, we sent out that work plan. It was really for your review to make sure like stuff looks like it's captured correctly. The one issue that I think Nita had brought up was just this question around looking at the data by mandate type. And so on the OCS website, like you can you can look at it that way. So it's just a matter of the one thing I can't do is like do a split screen. So you see Charlottesville and Albemarle at the same time. But you can see that data. So it's available. The question is sort of like, if you guys want to look at it, or if there's something, specific that you want to look at, like knowing that would be helpful. So it's really just kind of bringing it back here to say, is there something kind of more specific that you wanted to look at? Like I said, Nita brought up the specific thing about breaking it out by mandate type.
And I think also Jennifer and I can bring that as like a starting place. And we could go from there, if that's helpful as well.
I can't recall, breaking things out by mandate type, what the intent was. And so maybe other folks can help me understand the intent or the benefit in looking at that by mandate type. And if we can't recall or can't.
I'm
find
glad
the
you said that
intent.
because I can't either. So I was just looking back to see if it was in any of the notes.
And Nita did not leave me any notes on this, so I apologize for not being able to contribute.
I think if we can't.
I think it had to do with breaking down, I'm looking at the notes on the strategic plan. And now this is jogging my memory because I actually wrote those notes. And I think we wanted to see about breaking it down by race within mandate type. Jennifer, do you remember if
okay,
able to do that? I think we were.
Yes.
Yeah. So that's a little more specific.
That makes more sense as far as having context in our commitment to look at things with an anti-racist lens. Okay. If that is the recollection, I see there's benefit in that. Do others agree or disagree?
I don't feel strongly about it. What would we do with that information once we identify it? Are we just looking for a trend? I'm expecting we'll see a change, but I'm not sure that it's not already available to us on other sources. If it seems like a lot of work for Katie and Jennifer to pull it together, is there another place we can get that information and take a look at it?
If you feel like there's a way to look at trends to see if we're on track for one from an awareness standpoint, an advocacy standpoint, from an educational standpoint, making sure that we can see if there's any results or improvement around those disparities, increases in disparities, but just for this group to be aware of them. I'm all for ideas on how to be able to track that. I get a sense that no one else feels very strongly. So can we just, what page are you looking at on the strategic plan or the CQI tool where that is listed?
Let me see. It is goal 4, page 4 of the strategic plan. So I think, we revised the strategic plan so that we can take notes on when we discuss these different goals. So I can certainly add a note to help remind us about what we're deciding we want to look at or not look at right now.
We want to look at disparities and just track disparities, correct? We're tracking for awareness, progress, trends. But no one feels very strongly that that needs to be broken out by mandate type, or that we can recall right now. All right. Hey, we're here at our checkout point unless other folks had some comments or other information that Katie and Jennifer need for the CQI update.
I mean, I guess the question is, you know, do we want to bring that information or not bring that information to the next meeting? What are folks thinking? It sounds like yes, but it would just be for awareness purposes.
So you were saying that we could still look at disparities in our data, but it might not necessarily require a lot of extra steps. You're saying that data may exist presently for us to access.
I mean, I'm not really sure what I'm saying. I don't feel strongly about it. I feel like it is important to look at disparity, but I'm just not sure if it's necessary to break it down by mandate type, because I'm not sure what that really means to us. The solutions to that are probably going to be outside of what we have control over, unless, you know, it's important to point to illustrate that for folks.
I think the only, I mean, a discussion point, if we broke it down by mandate type, you know, might be, okay, DSS, you know, what are you doing? What efforts are you putting forth to, now that, you know, we are aware of this, to try to mitigate some of this? Like, I know, you know, with Charlottesville DSS, there's like the blind CPS reporting that's being done. So that might be an example of something that DSS is doing in regards to the racial disparities on referrals.
And that's what I'm saying. My understanding is each of us are already doing that. When we talked about, you know, our last roundtable discussion about what we're doing to address race, equity, diversity, and inclusion issues in our own practices, that we're probably already doing that. But I'm not arguing against it. Anything that leads to transparency is helpful these days, I think.
All right, so why don't we, it doesn't sound like folks are feeling strongly about breaking it down by mandate type, but maybe we'll continue to look at the data points that are already provided with a racial lens. Is that possible with the tool? Yes. Okay, great. So that's what we're going to do. And then we're going to continue our conversations around what each of our agencies are doing to promote equity in our agencies. Okay. Thank you all. Before we sign off, we're going to check out with any agency updates. So folks can go around and check us out by sharing some sort of update or success or highlight from the summer. Everybody can take a turn. Everybody will take a turn.
I'll go ahead and go first. You know, over the summertime, Liz Knotts, I don't know if everybody's familiar with Liz Knotts or not, but she became an ecotherapist, certified ecotherapist, and was offering a lot of adventure camps as she normally does. But we also got our ropes course up and going, and we've got certified individuals to provide team building. You know, it's a high course and a low course. So just wanted to do a shout out for Liz.
Nice. Okay. So there's a high ropes and low ropes course. Now we're moving back in person CPMT. We're going to get on some high ropes together. So exciting. Thanks, Tammy. That is exciting news. Who else has a highlight from the summer they'd like to share? I mean, technically it's still summer, but my kids went back to school and city folks, county folks will be going back next week. So what you got?
I would say that for our youth on our foster care caseloads, a little more than 60% of them are in kinship placements. And that's thanks to all the strong work that you all do. So thank you very much. The state average for that is 12. So we're really happy about that and proud of the work.
That's so incredible. I love that. We're so far above the state average. Like that's incredible. Who wants to go next? We're going around checking out highlights from the summer.
Well, city schools is almost ready to start again. Whether we are, they're coming next Wednesday along with the county. All of our new teachers came back last week. Our returning staff came back this week. So tomorrow is a real big conference day for everybody. Got lots of new folks in different positions, but it's going to be a great year.
Thanks, Beth. Sending all the good vibes y'all's way for this return week. Who's next?
I'll go. Can you hear me still? Yay. Okay. So I'm not going to talk about any diseases that could be happening. I'm going to say that what we've really tried to do in the last couple months is to promote people's self-care, because it's been so long, the P word that ends in C that sounds like pandemic. But we tried to really let people have some time back and to use that time and not think, oh my gosh, when I come back, there's going to be 7,000 things waiting on my desk. So we've all really tried to lift each other up and support people so they could refresh and be resilient for everything else that comes down the pike, which doesn't seem to stop. But anyway.
Way to walk the talk. And
I know, even I took time off, which I hadn't had in
a trauma supportive workplace. That's incredible. Thank you for sharing that.
I guess I'll go. At the end of July, I did a fill the bus backpack school supply drive for Fluvanna County High School at Zion Crossroads for Fluvanna schools.
They're back too, right?
Yeah.
Nice. That's exciting. Thanks for sharing, Andre.
No problem.
I'll share for community attention. I just got some great information from the summer program, the Community Attention Youth Internship Program, CAIP. They had a 95% success rate this summer. 41 kids participated and graduated successfully from the program. And it was close to 4,500 hours of internship hours donated to businesses and organizations locally. And our service program had 19 kids participate this year for to do some volunteer work and service in the community, and they donated close to 400 hours of community service to the community. So that's always good stats to read. Everybody's got to go. We got 2 minutes. Mary, Ellen, Taylor, Jennifer, Katie.
I can jump in. I don't know that I have, I don't have good stats to share, but we do have a bunch of new interns that have started in our Region 10 Child and Family Outpatient Office to hopefully expand capacity. So we're excited about that. And we're also gearing up for the next round of Community Resilience Initiative trainings for the trauma-informed care is coming out. So there's a fall flyer for that that's happening. There's been a lot of trainings that are happening overall. And yeah, so we're excited about those things.
Thanks, Ellen. I need to send some folks over that need some new hires that need that from our agency. So the CRI.
Yeah, I can send you the flyer. I'm also, I know my case managers are very excited that CAIP is back in person. That has been one of our great programs that we have seen a lot of kids' success in. So thank you for that.
So I was going to say, I can just jump in. Taylor is welcome to say something if she wants to, but I was going to say a highlight for me, particularly in CSA, is getting Taylor. So Mary was actually able to make this position available to CSA, and that's just been really, really exciting for me as CSA continues to be ever growing and becoming more complicated, and just it's nice to have her on board as support for the program.
Taylor, did you want to add anything about your role with Jennifer and CSA?
I don't know if I really have anything to add, but it's definitely been a highlight of my summer to gain this position, to be able to help you guys and be a part of the CSA and to be here in CPMT as well.
Thanks, welcome.
So I guess for us, our self-sufficiency team just last Saturday held a childcare job fair. And so it was for folks interested in becoming a childcare provider, but also for folks interested in opening their own like childcare daycare type center type thing. And there was interest in folk because, you know, we have a huge shortage of providers in the area for childcare. So there was interest. I think there were 8 or 9 folks that came out interested in starting up their own business or something like that. So that was a success for them. So they put a ton of work into that. So I was glad it went well for them.
That's a really awesome event, and I'm glad you guys got some interest.
Yeah.
Ashley Marshall, any highlights you want to share?
I haven't burned the building down on accident yet.
This is being recorded.
I know. I know. I would say that anywhere. Hey, that's an accomplishment some days. From your city manager's office, we are working on some items that will have hopefully positive impacts on your families, one of which is engaging in the police community search. And so for that, please note that all of you all living within our community, even though you may not be living in the 10 square miles, certainly can complete that survey. The survey for the community's input for the police chief search is available on the city's website on our splash page. So as soon as you go to www.charlottesville.gov, you will be able to click on a link. It is also in Spanish. So if you happen to have a client or former client that is primarily Spanish speaking and would still like to engage in the survey, please know that it is there and available. And I do not believe that there is a IP block on it. So if there are individuals who would like to take it using technology at our local libraries, for example, I think that multiple people will be able to sign on to that same unit and take that survey. It's fairly short, but it does give some opportunity for people to give us a little bit of input. So we hope to be able to find a great police chief to be able to be supportive of the community and to provide assistance as needed. And so I think that's probably the issue and that we are currently working on, that we would love to have input of not only you all as professionals, but also of your clients if they are willing to give us any of their thoughts.
Lisa. I can't hear you because you're muted, but maybe that's on purpose also.
I said, I'm just the secretary. I'm just typing. So I don't know. I don't have a highlight.
Okay, well, you are a highlight because I appreciate you for typing. All right. Thank you all for joining. We'll see you in person next time. Location TBD. See you soon. Thanks again.